So hi everybody, and welcome to our 2021-2022 season of IPHA's Third Thursday Lunch and Learn web series. This is our third season. We started doing this as a way to keep our network connected and share all the good work everyone is doing, and we're so happy to continue to see it grow. I'm Carmen. I am an AmeriCorps member serving with IPHA through Drake University's Engaged Citizen Corps. I'm going to go ahead and do our introduction, and then Brett, who is our AmeriCorps Vista, is going to take over for the Q&A section at the end. We dedicate this time every month to sharing our successes and even some of our detours that we may have taken to get to those successes. But the point of this time is to connect, learn, and strengthen the voice for public health in Iowa. We're really glad everyone is here, and we hope you'll be back next month, hopefully with a friend. Today, we're talking to Mary Kelly and Patty Quinlisk, who will be talking about preventing dementia. Before we get started, just a couple housekeeping items. Your microphone should be muted and your video turned off during the presentation. You will be able to unmute yourself and turn on your camera during the Q&A. And you can also put questions in the chat or in the Q&A feature of Zoom if you have them as they come up. So the session is being recorded and everything will be posted to the IPHA YouTube channel. So you can go ahead and watch that back later if you want to, or anything like that. And now I'll go ahead and pass things over to Mary and Patty.
Mary, do you want to go ahead and say something before we get started?
I'll just let you get started and chime in when my slides are up.
Okay, let me just get, so I'm not seeing all of you. Make it easier for me to do this. Hang on. Sorry, I'm trying to. There we go. Come on. There we go. Okay, so hello, everybody. It's sort of nice to be back with the public health community again. As you might know, I at one time was the state epidemiologist here in Iowa, but I did retire about 3 years ago, just in time to miss all of COVID, which at first I sort of regretted, but now I'm sort of thankful for. But one of the things I've been very involved in since I retired is doing Alzheimer's and dementia prevention. And through that, I've gotten to know Mary Kelly, and we'll talk a little bit more about how Mary sort of is playing a very important role in this program. But I want to just go through what is dementia, Alzheimer's, and what kinds of things the science says we can do to reduce our risk. And then we'll talk a little bit about the program that Mary and I are involved in. So here we go. Let me see. And it's not letting me change slides for some reason. This is interesting. I apologize. There we go. Okay, so I like starting out with sort of the big picture. And one of the things that is quite very evident is that if we go back about 30 years, Alzheimer's disease and other dementias really weren't even on our radar screen because we were dealing with all of these other diseases. So, but today, if you look at what people are dying of in the United States, Alzheimer's disease, which is about 70% of all dementias, so it's not even 100% of all dementias, 70%, is now number 6 in the United States as a cause of death. It's actually, if you go to the United Kingdom and they put dementia and Alzheimer's disease all together, it accounts for almost 13% of all the deaths and actually is the #1 cause of death for women in the United Kingdom. If we look just at Iowa and just at Alzheimer's disease, it is the 4th leading cause of death and it's #3 in women. And again, that's only Alzheimer's, which is only 70% of all dementias. I think if we would put all dementias together, it probably would be close to the #1 cause of death here in Iowa. And by the way, people always say, I don't realize that you could actually die of dementia or Alzheimer's. And the answer is absolutely, you can die directly of Alzheimer's or dementia. You can also die of it as being a contributing factor. One of the things, if you just look at the last 50 years and what's happened with causes of death, you'll notice that a lot of diseases have gone down, such as cerebral vascular diseases, heart disease, etc. And a lot of that, to be honest, is because people aren't smoking as much, which is a huge contributor to things like cerebral vascular disease. But if you look at Alzheimer's disease, you'll notice in about 1980, it started going up and it has basically skyrocketed. This is sort of one of the biggest issues that we in public health are dealing with today, is not just the fact that people are dying of this, but if you've had Alzheimer's disease or other dementias in your family, you know that it's an incredible, very terrible disease that people obviously not only can die of, but it takes maybe 5 to 10 years of worsening symptoms before you die of that. And during that time, it can be a terrible issue or burden for the family and other caregivers to have to deal with. So let's just first of all, just talk about what is normal cognition, mild cognitive impairment, and dementia. Well, normal cognition is probably where all of us are sitting here today, but it is a spectrum. And I always give the example of, my whole life have had trouble remembering people's names. And I know that even as a child, I had trouble with that. So for me at this point in my life, to have trouble remembering people's names is normal for me. But for somebody who all of their life could remember people's names without any problem, to now all of a sudden have trouble remembering people's names, that is not normal for them and may well be a sign of mild cognitive impairment. So what is mild cognitive impairment? Well, typically that's where we start noticing that we are not as good at doing things as we used to be. Could be remembering people's names, could be that we used to always be able to find our car keys. Today, we lose our car keys half of the time. But if you have mild cognitive impairment, you are still able to have enough cognitive ability to compensate for those things. You used to be able to remember the 10 things you needed to buy at the grocery store, now you can't, but you can compensate by writing a grocery list. Or you had trouble finding your keys now, your car keys, but now you put a hook by your door and you you put your car keys on that hook and you compensate for that. So now you always know that your car keys are on that hook. So when you start sliding into dementia, that is where you no longer can compensate and you have trouble. And basically at this point, you no longer can live independently. You have to have people around you to compensate for you. So this is not only where you lose your car keys, but when you find your car keys, you can't remember what car keys do. So normal cognition, you got your car keys, you know what they are. Mild cognitive impairment, you're starting to lose your car keys, but you put them on a hook by the door. Dementia, you see your car keys, but you have no idea what car keys are for. But the thing for all of us to remember is dementia is not a normal part of aging. Years and years ago, when my grandfather got senile, and that's what they used to call it, senility, people just sort of shrugged and that said, well, that's just, he's getting old. Well, it is not a normal part of aging. So again, here's some specific definitions of cognitive impairment. And cognitive impairment is the first step towards going into dementia. People usually don't go from normal cognition to dementia unless they have some kind of severe brain damage. Usually you start going through mild cognitive impairment, start going into more noticeable problems, and then you gradually go into dementia and you no longer can live independently. One of the biggest problems here in Iowa is the kind of things that we in public health or people who are in the medical field start having to be aware of, is that cognitive impairment starts really affecting people's health. We know that about 9% of people who are 50 years of age and older perceive themselves as being cognitive impaired. In other words, they start realizing they have to write grocery lists or they lose their keys or whatever. And about 20% of people who are adults who perceive that they have cognitive impairment have had to change or give up some of their household activities. Typically, we see that in older people, even though they know that car keys are for your car and know about that, they give up driving because they're concerned they can't remember where they're going or the streets that they go to that, and they might get lost. So they're giving up activities. The problem is that 80% of those people have not talked to their healthcare provider about it. And part of that is this, oh, well, it just is happening and there's nothing I can do about it. But 35% of those people who have noticed memory problems live alone. So they are not having somebody around who can assist them. And this was put together by the Iowa Department of Public Health. It's a great graphic just talking about what are we seeing here in Iowa. There are people who have subjective cognitive decline. They're noticing symptoms. They have memory problems, which is one of the most common symptoms of cognitive decline. But again, people are starting to have problems with it. They need help with household chores. They give up day-to-day activities. It interferes with social activities, their work, or doing things like volunteering. What are the risk factors for cognitive impairment? Well, some we can do something about, some we can't. One of the biggest risks is just getting older. One of them, though, is genetics. There is a gene, an APOE4 gene, which does increase your risk of dementia. But the things I'm going to talk about today, all of these things that we can do to prevent dementia, can actually get rid of all of the influence of having that gene. Some of the scientific studies you have done suggest that even if you have two versions of this gene, one from mom, one from dad, that if you do these lifestyle changes, these behavior changes, the influence of that gene is totally abrogated, and you can get back to basically somebody who does not have those genes. Let's go on. Diabetes is an issue, especially uncontrolled diabetes. If it's under good control, probably its influence on cognitive impairment is, again, goes back to normal. Smoking, and we'll talk more about things like poor diet, high blood pressure, high cholesterol, lack of physical exercise, and lack of mental stimulation. Now, people always think, well, if I get Alzheimer's or something, I'll just go to my doctor and get a drug. Well, unfortunately, right now, there is no cure whatsoever for things like Alzheimer's disease or dementia. In fact, some of the big medical pharmaceutical companies are stopping their research in it because there just doesn't seem to be much that is even suggesting it might work. So this is a problem. Not only do we not have drugs, but not very many people are even looking for something. And my take on this is it may be that by the time you have Alzheimer's or dementia, the damage to your brain is so far along that there will be nothing that we can do to cure that or go back into normal, because as we know, neural tissues really do not regenerate themselves. So here are all these things that people have tried and done. The bottom line is none of these seem to work. There are a few, as Mayo Clinic says, there are a few medications that can help for a time to alleviate some of the symptoms, but these do not work very long, maybe 6 months to a year, and then you're right back to where you started from. So the bottom line is there is no magic pill for dementia or Alzheimer's. This is just something that we have to admit to or realize. But the issue that we are here to talk about is what does work? How can you save your brain? And the answer is prevention. There is more and more science coming out. There is a lot we can do to prevent dementia or Alzheimer's.
And Patty, this is where the poll is coming in.
Sorry. Okay, go ahead, Mary.
Okay, Brett's gonna launch your poll, or Carmen. Pretend you didn't see the slide.
I'm sure gonna try to. But it says that I'm okay. Hold on. I think I have to sign out somewhere else. I'm having technical difficulties. If it doesn't work, it's on the slide, right?
I launched it.
Oh, you launched it. Oh, great.
I just tried it, and can everybody see the poll?
Yes.
Oh, perfect. All right. I'll be quiet then.
I was lucky that I was co-host and saw it, so all good. Thanks, Brett.
It sounds like everybody has answered. Oh, maybe not, sorry.
No, okay, the answers are slowing down, so I can end the poll and let Patty go on.
Okay, and I do apologize. I should have stopped there, but I forgot. So the bottom line is, as more and more of this science comes out, and we know that prevention works, the question comes up, how much can we prevent? And now my screen doesn't work anymore to advance my slides. You have to give me back control. Yeah, I'm not advanced. I can't advance my slides anymore.
You are still co-host, so I don't think it's that. I'm not sure what the problem was.
There we go.
There it
Maybe
goes.
it just
All
took
right.
a minute. Sorry. Okay, so right now, the current science indicates that individuals can reduce their individual risk of cognitive decline dementia up to 70, perhaps even 75% of your individual risk you can basically reduce. And that about 40% of all the dementias in our communities can be prevented. Now, sometimes they say can be delayed, but to be honest, if you delay dementia until after you die, who really cares? That's still preventing it. So 40% of all dementias, we believe, can be prevented in our communities, which just think about the impact on a community of cases of dementia. It impacts the family, the caregivers, community services, hospitals, long-term care, assisted living, etc. 40% would really take a huge burden off of our communities. So what can we do to reduce our risk? And I know everybody would like me to tell them, well, if you just do this one thing, one time and you're done. But as we found with almost all of the chronic diseases in our communities, it takes a lifetime of basically healthy living behavior changes to reduce the risk. So these are the things that we need to do to reduce our risk. And I'll go through each one of them individually, but they're basically to eat well, to get moving, to stay sharp, to be social, to sleep enough, to address your chronic diseases, reduce your stress, make sure that you hear well, whether that's through your own ears or with hearing aids, avoid bad medications. We'll talk about what they are. And then there's some other things that we can do, but these are the big ones that we can do that will take our risk down substantially. So let's start out with how do we eat well? Well, we've all heard about the Mediterranean diet. That's probably the healthiest diet that we know about right now. There's also what's called a DASH diet, and some of you may have heard about this before. It's basically dietary approaches to reducing hypertension. So it's basically a low sodium diet. But what some people did at Rush University is they put the two together and said, if we take these two diets that we know are really good, especially as people get older, will it affect our risk for dementia and Alzheimer's? And they found that yes, it makes a huge difference. They followed almost 1,000 people for about not quite 5 years. And they found the longer that people had followed this MIND diet, the Mediterranean DASH intervention for neurodegenerative delay diet, the less risk they appeared to have. In fact, those people who followed the MIND diet only moderately well had about a 35% reduced risk of Alzheimer's over those 5 years. And those people who followed it rigorously, their risk reduced by about 53%. Since then, there's been several large other studies done, either looking at the MIND diet or looking at basic Mediterranean diet with some emphasis on things like leafy green vegetables, and found that yes, those significantly reduce your risk of cognitive decline. So that is one piece of it. Another piece is get moving. We don't call it exercise. We found in the older community, if you say exercise, they think you mean you have to put on black spandex shorts, go to the gym and sweat. And they found that you really don't have to do that to start reducing your risk of dementia. Even mild physical activity, such as walking, can decrease your risk of cognitive decline. And they found that this exercise or movement actually seems to reverse cognitive impairment or improve cognitive function. As said before, that there's nothing we found that will basically reverse or cure dementia, but if you are in those early stages of cognitive impairment and start doing a good exercise program, that you can actually reverse that cognitive impairment. You get your memory abilities back, et cetera. You start remembering people's names better, whatever it is that you've noticed. Now, what kind of movement does it have to be? Well, it has to be regular. So you really need to be doing it almost every day. It needs to tend towards more vigorous. And we just define that as meaning that you notice that your heart rate goes up and you're breathing faster. But there really so far is no defined duration, a specific type of exercise, or a specific intensity. The CDC guidelines basically say people should move for 30 minutes, at least 3 or more times a week. So that can be as simple as us getting out and walking for 30 minutes 3 times a week. And we can still, with that minimum of movement, can start seeing pretty significant changes in our risk for dementia. So if we drill down a little bit closer, if you do vigorous, and again, that's just defined as increasing your heart rate and your breathing rate. If you do that 1 to 2 times a week, you can have a 29 to 40% risk reduction. If you take it up to 3 or more times a week, 35 to 50%. So that vigorous exercise, most days, you can really significantly reduce your risk of dementia. And it can be something as simple as walking, biking, swimming, whatever it is that you like to do or that your physical state allows you to do is something that will reduce your risk of dementia. Now, one of the other things we talk about is you need to stay sharp, sort of that use it or lose it. It's just like muscles. And, you know, a couple of years ago, they said, oh, just do a crossword puzzle every day. Well, they've actually looked at crossword puzzles and in general know that just doesn't seem to be hard enough to really make you use your brain and keep that cognitive use high enough. So what they're really looking at these days is things like speaking another language or learning another language later on in life, or learning a new skill, such as taking a college class, by the way, not just passively, but you have to take the class and do the tests and write the papers, or learning a musical instrument. And you'll notice that the things that are given here as examples are things that are hard, things that take time, and things that you use. So we're not talking about a crossword puzzle. But if you do these things, you can decrease your risk up to 47 or 63%. By the way, by now you probably noticed that all these things will add up to much more than 100%. And that is true. And that's because a lot of these things cross over. So if you are, for example, exercising, usually you're eating better. If you're staying sharp, you're often doing the next thing we're going to talk about, which is being social. So a lot of these things do overlap, but what they've thought is that we probably get up to about 75% of your risk can be reduced. So the next one is being social. People who are isolated and severely isolated can actually increase their risk of dementia by 60%. And by this, we really are talking about the person who lives alone. They have no friends, no family. They don't do any interaction with anybody else, severely socially isolated. Most of us are not that isolated, but we do know that that social interaction can be incredibly important for people and can decrease their risk of cognitive decline. And if you just look at people who are very socially active, compared to people who have no social activities at all, they have about a 50% decreased risk compared to people who basically don't have any social interactions. We suggest having a lot of social ties. And by the way, there are 3 different levels of social ties. The basically people you can call at 3 o'clock in the morning who will be at your door if you need help, the typical friends and everything. But the 3rd tier is the connections we have to our communities, where we know people we walk into, for example, to go get our coffee and the person says, "Hi, it's good to see you again today. Do you want your usual?" There may not be your friends, but they are people who basically tie you to your community and make you feel you're a part of that community. Now, most recently, one of the things that really has come up is that we need to be able to hear well. Now, why is hearing so important? We don't know, but the Lancet Commission, which is online, came out a year ago. I would really suggest you read this if you are interested in the things we can do to reduce our risk of dementia. They call hearing to be the most easily modifiable risk factor that we have out there. The reason they say most easily modifiable, all you have to do is go have a hearing test. If you have a hearing impairment, you wear a hearing aid. Boom, you're done. They think that about 8% of all of the dementia risk that we have in our community is due to hearing loss. But if you have hearing loss, it's only if you have that hearing loss and you are not using some kind of hearing aid. And this risk of dementia increase by about 1/3 for every decibel of worsening hearing loss. But the good news is if you get a good quality hearing aid, and these hearing aids are getting better every year, that alone basically gets rid of all of this risk. You can go back to a normal risk if you just address your hearing loss. So we are recommending that everybody, especially when they get older, to have yearly hearing tests to make sure that the moment they start having trouble hearing, they get some kind of assistance in their hearing. The next thing is there are a lot of medications that are really bad for our brains, especially as we get older. Most of them are what we call anticholinergic drugs. We need the choline in our brains to make those connections between our neurons. And if we take anticholinergic medications, it basically blocks one neuron of our brain from talking to the other one, and you can see why that would be so important. And I'm just going to tell you an anecdote. 2 weeks ago, we had a class where we had people come in to learn how to use poles for balance and for Nordic walking. And somebody who's taking our class right now came up and said, "I heard about the anticholinergic drugs, specifically Benadryl. My husband was taking it every night and has for years, and he had become very forgetful to the point that he couldn't even carry on a conversation. And I was thinking I was going to have to put him in some kind of assisted living very soon. I heard that he shouldn't be taking Benadryl. We took him off, and within 2 weeks, he was back to normal, having normal conversations, not forgetting things anymore. So some of these drugs can be incredibly powerful and can really impact our abilities." And she thanked me and said, "I'm now not even thinking about having to put my husband into assisted living anymore because he's back to normal." So anticholinergic medication, anti-anxieties, there's even some sleep medications that are bad. In the class we teach, which I'll tell you about, we actually have a geriatric pharmacist go through all of the medications our people are taking and come back with recommendations of which ones they should, basically, if they're over the counter, stop taking, or if they're a prescription, they should talk to their doctor about taking something different or decreasing the dose or things like that. So here's just a list of some of these drugs that really can impact your brain, and they're not all prescriptions. Some of them are over the counter, etc. So there's some other risk factors that go into this. Smoking is terribly bad for your brain. If anybody in your class smokes, which, by the way, nobody has admitted to it yet in our class, they should stop immediately. Good sleep is really important. We actually do spend quite a bit of time talking about sleep hygiene, how to sleep well, and if you need a sleep aid, what ones you should take and which ones you should not, such as Don't take Benadryl, which is often the Tylenol PM or Motrin PM or whatever, Excedrin PM. The PM always means Benadryl. Those are very poor, very bad for our brains, especially as we get older. Poor control of chronic diseases such as diabetes, blood pressure, stress, and chronic dehydration can be very bad for your brain too. So at the IDPH website, some of you may already be aware of this. We have a quiz and have for several years. It's recently been updated. Thank you very much, Jill, and everybody at IDPH for all your help. There's a quiz that you or your parents or other people can take, which basically just says, how well are you doing to reduce your risk of cognitive decline, dementia, and Alzheimer's, and what things maybe you need to be working on to further decrease your risk. And we also have a community-based dementia prevention program that I am involved with, and Mary Kelly is also, and it's a collaborative effort between the YMCA, the Iowa Department of Public Health, and Broadlawns Medical Center. So I think now, Mary, I'm going to turn it over to you, but I'll change the slides just since there's only a few. You just let me know when you want me to change them.
Absolutely. So thank you. So Patty gave a really good foundation about the Saving Your Brain program. It is a 10-week course, and the course was developed by Dr. Quinlisk and Dr. Shaw from Broadlawns, and in conjunction with IDPH. And so it has a lot of adult learning methods involved in it. So each class of the 10 weeks starts out with goals sharing of the previous week's goal. So that's not part of the first class, but all the participants learn how to set goals, and they're SMART goals. And each class is limited to, the ideal class size is 15, and the minimum is 10. And so we really liked 15 because that way they can have time to goal share and also have accountability with each other. And then there's a talk, and the talk is on one of those 10 to 12 risk factors that Patty already has described above. And then the class ends with goal setting, and sometimes the goals are from the topic of the class that they learned that day. Like if they have a dietitian come in and speak, they might do a dietary goal. And then they have the next week to work on that goal, and it starts all over again the following week. So each class is about 2 hours. It's a commitment, and we have everyone at the first class talk about their commitment to attend the 10 weeks and also to share and be confidential within what is discussed in the class stays in the class. And the accountability is to your fellow attendees. A big part of the class is that that there are 4 individual one-on-one sessions with, as Patty mentioned, a geriatric pharmacist, a dietitian, a fitness expert who knows how to detail the exercises to meet the fitness goals of that individual participant. And it's not a one-size-fits-all. So someone has mobility issues, or is there's like 3 different levels right now of the current fitness experts. We have some videos on how to do some exercises for any level of fitness activity. And then an overall health coach. And there's also an audiologist that does presentations, and those are an optional one-on-one session because not everyone needs to have a hearing test, but those they make them all available for hearing test and any kind of follow-up. Let's see, what else are there in those classes? So we received, the YMCA of Greater Des Moines received a Telligent grant to expand this. So Patty has been conducting these programs for about 4 years in Metro Des Moines. And Patty, is that right, or is it?
Yeah, more like 3 years, but we started working on it 4 years ago, but we started our first classes 3 years ago.
Okay. So, and then in the last year, we have the YMCA, where Patty was working out of, received a grant to expand the program. And so we've worked on writing all the curriculum down. Patty's brain is hard to translate. There is actually very easy to translate, but somebody had to replicate it by writing it all down. And so we made it into a toolkit. And so we can replicate the program, and we did in 4 different YMCAs. So one is still in the metro area, but it's not Patty or Susan Skinner, who were the previous facilitators of the programs. But we replicated the program in 4 different YMCAs with 4 different instructors through a toolkit and a series of trainings. And it's been successful. We ended the 10-week class ended this week. And we are just starting with the results. So Patty, I think you can go to the next slide. So, so the Y right now, it's only the Y has hosted the programs, but we are open to hosting the programs in other areas. Like we see, we're trying to target the at-risk communities, the minority populations, the elderly that are socially isolated. So we are looking into getting additional funding. And we also are open to working on replicating the programs in different areas. And so if you are interested, you can contact me through the Y. But there are classes right now, and the classes ideally are held in person because you want that social interaction. But realizing with COVID, we moved some of the classes to be online and via Zoom. And this has opened it up to people from actually around the country, outside of Iowa, even taking the Zoom classes. So another thing that I should mention with after the 10-week class is over, we are, Patty has organized, it's like a monthly meeting to online kind of socialize and continuing education on some of these dementia risk populations or topics. Next slide. So here is some preliminary results, and actually everybody here knows with data and public health that that data changes. And so this was after one course, one place, but now we have results from 26 responses. So the pie is going to look a little bit differently, but 26 responses said that their fitness scores, which they do a fitness test at the 3rd class and then at the 10th class, and the fitness scores have improved for 81% of the 26 participants. I just got the latest data because, again, the courses are changing or ending, and so I'm getting newer data. So it's just thrilling to see the objective. And then the Save Your Brain quiz that Patty also mentioned, that's available on the IDPH website. Everybody has gone up some categories of showing improvement on their cognitive ability. But just looking at there has not been one negative comment. Everybody has comments very similar to these 3 that I have listed. Go to the next slide. So here are the upcoming classes that are scheduled. And again, there is going to be one on Zoom. So this can serve anyone in the state or even outside the state. There is a registration fee, and the class, it's $200, and that sounds kind of high, but it's 2 hours for 10 weeks, plus they get individual sessions with 4 different professionals. And so I think when I took the class back at Broadlawn, Dr. Shaw estimated it at like a $2,500 class worth of all the time, the expertise that's going into the counseling sessions through this. So, so this is the information for the classes. The 4 pilot programs that we had are all going to conduct future programs. There usually is there's a demand for this because everybody tells everyone about the class, and then they have their friends take it, and some people even want to take it again. So I'm not saying that there's waiting lists, but they are planning all these areas for ongoing programs. Patty, I think that's it for me. I think it's back to you.
Right, and I would just say we have places that have contacted us that are interested in doing these in the future, and Mary's put together a wonderful toolkit. So this really is a drop-in program. If you have, for example, COVID funding or whatever, and want to grab this program and provide it in your area, either with a Y or a hospital or a church or a senior living center or whatever, it's basically the toolkit's ready to go. We would do a training with one person to become the instructor and the organizer for the program. And then you just need to find community resources like a pharmacist, et cetera. But it's drop in, and we would love to see this program expanded to other parts of the state. As Mary said, we do a continuing class every month that's free of charge to anybody who's taken the class, just to keep people working on things. And we do have a website that we put together. It's called savingyourbrain.org, not .com. .com, as I understand, is like the football players and concussions, but savingyourbrain.org is us. A lot of information is there and available. You can go into the resources area and see all the handouts we have for the classes, get a feel for what's in the class. So lots of stuff is available. And if anybody is interested, please go ahead and contact Mary or myself, and we will help you start a program in your area. I think I'll get out of the slides. Oh, I love my Dr. or Mr. Spock, live long and prosper. We want all the people in our communities to basically live long and healthy lives and a productive life, not to have a life where they spend the last 5 or 10 years of their life, as unfortunately my mother did, with pretty severe dementia and not a very fun life, to be honest. And it wasn't fun for her, or wasn't a good life for her, and it wasn't for the rest of the family either. And we just want to, as much as we can, to prevent that from happening to other people and to their families. So I think that's it. Let's go out of this and just get back to people and just see if, I think we can spend some time just doing question and answers. Mary and I, I'm sure, are very willing to answer any questions. And I saw that Jill from IPHA is on the site too, who also has some knowledge of trying to prevent dementia in our communities. So why don't we, if it's all right with whoever, we open it up for questions.
Yep, of course. So you can put your questions in the chat, or if you'd like to, at this point, you can turn your camera on, take yourself off mute, open it up, speak out loud if you'd like, whatever works for everyone else.
Hi, well, I have a question, if I may. So my father's been suffering from what seems to be a combination of delirium and dementia. He's had some hospitalizations. It's very hard to tell where one begins and where the other ends. I wonder if you have any experience with that and what your thoughts are.
Well, I don't have any experience with treatment. And again, my understanding of once a person basically has enough symptoms that they have the diagnosis of some type of dementia, that the kinds of things that we promote maybe makes them feel better, but will not impact the dementia nor their progression. The science really suggests you need to get people into these programs when they're still cognitively intact, or at least only have minor cognitive decline. Though that seems to be reversible in the very early stages, et cetera. But like I said, we have people who have, like the story I told, was taking Benadryl and was having no memory and couldn't hold a conversation. And just by something simple, taking them off the Benadryl, basically got them back to normal cognition. We've had some people who have had significant hearing problems who, for whatever reason, resisted getting their hearing tested. And once they did and got a hearing aid, all of a sudden, a lot of their symptoms disappeared because they could hear again. And we've certainly had lots of people who say, I feel better, my mental awareness is better, I'm doing more, etc. But again, that's primarily people with no symptoms at all or very minor symptoms when they start the program.
Thanks.
Patty, I'm going to read one out of the chat. It says, what does delayed memory mean? I see someone in the supermarket and don't remember their name, but hours later it comes to me.
Yeah, and delayed memory, what the thought behind that is, if you have something that you, a memory or a skill or something like that you use every day, you have not just one neurological condition, you have many. And that's why people can sometimes sit down and play a piano piece without any piano music in front of them. They've just gotten that memory so down pat that they don't need any kind of reminder. If you see somebody at the grocery store that you've not seen for 5 years, obviously you may only have very minor connections, and therefore it takes your brain a while to find that connection and reconnect. If you saw that person every single day, you wouldn't have problems with that. So that is really not dementia. That's just the way our brains work. And again, some people are better at things like names or remembering piano music or whatever. As long as it's not changing, that is probably not an issue as far as cognitive decline goes. It's just the way your brain is working. I see one saying, I'm taking Zyrtec every day. I suppose I should not be doing that. And I'm not a pharmacist. I'll just tell you what our pharmacist says. There are some medicines that are on that list that you need to take for other medical reasons. But there may be some things that are better or worse or have less or more impact. And sometimes people get on a dosage that maybe can be backed off a little bit. So I wouldn't say don't take, but what you might want to do is talk to your pharmacist or your healthcare provider and say, I'm a little bit concerned about this because it is on that list of things that could be potentially bad for my brain. Is there an alternative that will work as well? Or maybe we can back off on the dosage a little bit and I still get the relief I need. So those are the kinds of things I would tell you. The only thing I probably, there are some drugs if you're taking right now, especially over the counter, you might want to really start backing off now. But any prescription drug or drug that you're taking with your healthcare provider's advice, I would just suggest you talk to them before backing off on those drugs or stopping them. Some of them you don't want to stop abruptly.
Scrolling up, I see a question from Heidi. She said, I wondered if there are any resources for families that can't afford the $200.
What we do at the Y is we do have scholarships. We do it on the same sliding scale that the Y uses for their membership. So yes, there should be no financial barrier to anybody to taking this class. $200 sounds like a lot, but when you break it down, that's $5 per hour for the classes and $20 for a half-an-hour session with a professional dietitian or pharmacist. So really, you go to some places, and as Mary said, these classes and other places are thousands of dollars. We would like to make it so it's free, but we have to pay the dietitian, the pharmacist, the people who do this. We do have a lot of our people donating their time, but not everybody, and we can't expect that. But again, if you know somebody who wants to take it, but is financially not able to pay $200, let us know. We do have a fund that we pull on to pay for scholarships. The lowest scholarship, we do those $20. Everybody has to pay a little bit, and that's because of adult behavior modification. You do not make behavior changes if you feel it has no financial worth. So the lowest, so everybody has to pay at least $20.
Jill, do you want to say out loud what your comment is for people? Because I know if some people called in, they wouldn't be able to read the chat.
Sure. Thanks, Mary and Patty. I'm Jill Myers-Gettleman. I'm with the Iowa Department of Public Health, and Greg Woods is our new coordinator for a new cooperative agreement funded project that we have with the Centers for Disease Control and Prevention. It's a 3-year project. We've just started year 2, and a part of the work that we're doing, along with getting some education out and partnering with people like Patty and Mary and the Y, is to convene a group of people interested in the work around Alzheimer's and related dementias in a coalition, and also to put a state plan together. So we're working on both of those, and just encourage you, if you're interested or know of someone else who could be a great effort partner with us in this, to get in touch with Greg. So I did list his email address in the chat, but I could give a phone number for him too. Let me do that in case there are people on. Sorry, just a second. His work phone number is 515-217-8955, and that's Greg Woods. So thank you. Thanks for the opportunity.
Patty, is the medication list on the Saving Your Brain website?
Yes, you would go into the website to the medications area, and there's a slideshow where there's multiple slides on all of the different drugs, supplements, etc., that would be considered not good for your brain, and that, again, you may want to discuss with somebody getting off of it. And by the way, we'd love to have a slide that says these are the things you should take, but there aren't any. You know, people try things like ginkgo, the science is really not good. Turmeric, science not so good. But she does have a list of ones that you might try because they've found not to be harmful, that you could potentially try. But there's a lot out there that have wild claims to helping your brain where there's no science whatsoever behind it. And that there's some that could be potentially harmful too. Maybe not to your brain, but to your health. So.
And Jody, we are open to bringing the program to areas that are outside the YMCAs, and we've been talking to senior centers and such. So you can definitely contact me if you have a specific area, or especially if you have someone we can partner with. We have been in contact with the AAAs in Iowa for this.
Yeah, hospitals would be a great place. Senior, like senior centers that you have in your communities. Not every community's got a Y. The Y is nice to partner with just because they can provide you with a fitness person, a room, and is a nice place to meet because then you can really get the people to go and work out before or after the class. But it's certainly not a necessity. It's just a convenience. And they've been a great support for all of us throughout the state. They're just a great partner, but not an absolute necessary partner. Yeah,
Patty, I have a question. What's being done to educate providers and prescribers on the effects of some of these more common drugs? For example, I take trazodone to help me sleep, which is a great to help me sleep, but now I see that's on the list. And so, but my provider told me, oh, you can stay on this forever. There's no ill effects.
Yeah, and I'll just say a lot of this is just that the science is new enough. You know, if you went back 10 years ago, nobody was talking about dementia prevention. It was all like, it's going to happen, just nothing you can do. It's really in the last 10 years, people have been thought about. In the last 5 years, we're starting to get really good scientific studies saying what you can do. Because of that, a lot of our healthcare providers, whether that be doctors, nurses, PAs, when they went through school, nobody was talking about this because it wasn't something that was even on anybody's radar. So we are trying to get the word out, not only to pharmacists and to healthcare providers about some of this negative stuff. We would love to also get a better word out to the healthcare providers who have patients coming in saying, I'm worried that I'm going to turn out to be like my mom or my aunt, and have them know that these programs exist that they can refer patients to, where we do talk about these things. And Dr. Yogi Shan are going to try to do a blitz this spring to all of the medical professional conferences, which hopefully we'll start meeting in person, to basically say, look, these programs exist and you can refer your patients to them. And that's one of the reasons too, we'd like to have it available in a lot more places in Iowa, because it is something that is needed out there, but it's just so new, very few people know about even that you can prevent it.
Karen asked, is there access to the Avoid Bad Meds list slide?
Yeah, again, if you go to our Saving Your Brain, all one word, savingyourbrain.org, and then go into the resources place, drop down or into the medications, you'll find a slideshow, and that was put together by our geriatric pharmacist. And in that slideshow, she goes through all of the meds and why they're bad and what are anticholinergic drugs, et cetera, and to the over-the-counter ones, the supplements, et cetera. And so that slideshow is there. And I believe there's even one handout that has just a list. But to be honest, there's so many that it would be hard to really try to memorize all of them or whatever. But again, if you take our class, one of the things we do is you sit down with a pharmacist and go through everything you're taking, and she gives you individualized advice back about what things you should just stop over the counter, what things you should talk to your healthcare provider about, switching or changing and giving you options of, if you're on this drug, maybe try this drug instead, with the help of your healthcare provider. And she will talk with your healthcare provider if they're one of those people who just, has not been trained on this, because it is new. We can't expect everybody to know everything about all of these drugs, but it's starting to get out there, especially with the pharmacists and stuff. So it's something at least you can start a discussion on.
All right, well, if you have any other last minute questions, go ahead. Otherwise, I think we'll work on wrapping it up. Be respectful of your time. Get out of here by 1.
Yeah, there's somebody said the Beers list of medication is a good reference. Emily, our pharmacist, does talk about the Beers list. It's a list that the pharmacist organization has put together about drugs that basically should be careful in seniors. So thank you for reminding me that. That's great.
I have one quick question. So earlier you were saying challenging our brains beyond a daily crossword is really important, but what about those that found crosswords difficult in their 20s or 30s? I'm thinking of my dad. He didn't go to college. He's worked a blue-collar job all his life. I don't think he has a very high IQ. He's a great man with lots of other great qualities, but how to stimulate the mind?
It has to be new, and you have to use it. So if you're somebody who does a crossword puzzle in 5 minutes in ink, you're really not using your brain. But if you're somebody who sits down with the New York Times, it's hard for you, it takes you hours, and you're looking up the questions to put in, then you're using your brain. So it sort of depends on how you do it for yourself. What does that mean for you? So yeah, if he's using it as a brain stretching exercise every day and it takes him a while to do it, that's probably good for his brain. Okay. Well, again, I'll just say before we go, Mary and I are available. If you have questions or interested in the program or whatever, let us know. We're very much interested in trying to get this program expanded and preventing as much of the dementia out there as we can. And thanks to Jill, IDPH has been just a great resource for us too. Thank you.
All right, well, thank you, Patty. Thank you, Mary. Thanks for sharing your expertise with us today. And thanks to all of you who came and shared your lunchtime with us. We hope you can join us again next month. It'll be on December 16th. We'll be joined by Roxanne Kojal of the Epilepsy Foundation, Iowa. And we're still always looking for new topics. If you have any ideas, contact myself, Lena, any of us, and we can see what we can do about getting your work or the work of your colleagues showcased in one of our future lunch and learns. Just a reminder, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to help support our mission. If you're not already a member, please consider joining IPHA. If there's any students here, you can check with your department chair. Some programs have funds to support your membership. If you are a member, we thank you. We appreciate any donation that fits within your budget. You can join and donate at iowapha.org. The recordings of all Lunch and Learns, this one and any prior ones, will be archived on Iowa Public Health Association's YouTube channel. You can also find any other webinars that you may have missed or want to revisit. So again, thank you. We hope to see you all next month. Thanks, Mary and Patty.
Thank you for having us.
Yep. Have a good rest of your day, everyone.
Bye-bye.